Hello everyone, welcome back to Daniyal Ultrasound Clinic. Our today's topic is Utero Vaginal Prolapse. So we will see how to identify it on ultrasound especially, and we'll describe findings and understand its gradings as well as clinical significance. So patient here complains about feeling of something coming out per vagina and pelvic heaviness and discomfort, especially she's complaining of dysuria. And it usually commonly occurs in multiparous women due to weakness of the pelvic floor muscles and uterine supports are following menopause. So, how to approach on ultrasound? You from this picture, this is still will also watch it on real time. But initially, let me describe few things which are very important. Like on ultrasound, the uterus is usually displaced downward and often below the level of the urinary bladder. Let me show you that. Here you see this is uterus. This is above this. This is urinary bladder, and uterus is downward, drawn downward, and slightly below the urinary bladder on longitudinal section. You see. The uterus is below the level of urinary bladder or base and towards or beyond the introitus. Now, cervix and vaginal canal appear elongated. Like here you see, this is the cervix and vaginal canal which are elongated, thickened. Uh, the urinary bladder neck also appear very close and adherent with the uterine cervix and canal. And there are few certain more few other things which I am going to describe with this patient. So the uterine outline here is smooth. Central area is the canal. This is canal, which is showing mid-cycle phase, triple layer appearance, mid-cycle phase. Okay, it measures approximately here 0.9 centimeters, is slightly thickened due to mid-cycle phase. Outline is again smooth. There is no evidence of solid or cystic mass in the uterine parenchyma. This is the posterior part of the uterus. This is the anterior part. And now important thing is to how to grade the uterovaginal prolapse. The grade 1 is the descent of cervix, but cervix remains inside the vagina. So this is the grade 1. I told you descent of cervix, but remains inside the vagina. And the grade 2, cervix appears at the introitus during straining. And grade 3, we can say that when cervix and part of uterus protrudes outside the vaginal opening. And the grade 4 is uh, entire uterus and vagina, their vaginal walls are outside the introitus. So that would be the grade 4 and extreme uterovaginal prolapse. And associated findings may be there sometimes, but here there's no associated finding like cystocele or rectocele or postmenopausal uterine atrophy or pelvic floor laxity, but the uterus is here healthy and enlarged, showing thick endometrial cavity. So, friends, this is how we can identify and describe the intrauterine vaginal prolapse, uh, uterovaginal prolapse, sorry, on ultrasound. Always remember to scan dynamically. Observe the descent vaginal, on Valsalva method, which I'm not going to ask patient to perform their thing because that would take definitely time and the patient would be uncomfortable. So this was that I wanted to share this important finding of pelvic ultrasound. Again, I'm describing or reminding you this is the uterovaginal prolapse. Cervix here is thickened and enlarged, showing here it is obscured. The lower part of the cervix and vagina are obscured almost and but thickened. So this is the main sign, and again the history also plays important part. Like when you ask the patient would tell you something is coming out of the vagina when they touch their urogenital parts. That would further confirm the diagnosis. So here is the uterovaginal prolapse. Thank you very much.